Colon cancer is one of the 17 types of cancers on the rise among younger adults. In fact, the American Cancer Society reports colorectal cancer cases doubled among those patients under the age of 55 between 1995 and 2019. It is the third most diagnosed cancer here in the U.S. and the third most common cause of cancer-related deaths in the U.S. So in the search for what is causing it to go up, researchers think they have found a possible cause for higher cases among the younger adults. New research published in the journal Nature last week reveals a gut toxin could be to blame. Mercy Health Oncology and Radiology Doctor Carl Peterson is back with us to explain what the medical research is pointing to. Dr. Peterson, in that research I mentioned, it's pointing to a gut toxin for the potential eventual cause of cancer. So what is the toxin from, and how do experts believe this is even happening?
Well, certainly there's a massive increase in colorectal cancers across the country, but particularly in the young. There are multiple reasons that are speculated for the massive increase in young colorectal cancer diagnoses in young individuals. The toxin itself is related in this piece of research, may be one piece of the puzzle, and that would be due to the changes in the bacteria and other organisms that live in the gut, small bowel, large bowel, etc. And it appears to us, as we look at the research, that there are several known factors that includes a sedentary lifestyle increasing risk of colorectal cancers. Certainly, as data published up at Case Western Reserve states that obesity is linked to colorectal cancers in young people, to growing problems in the United States, certainly. But that doesn't explain everything.
Where's this bacteria coming from?
Well, it's bacteria that's typically already present in the gut, and changes in those bacteria that are present in the gut can allow for growth of organisms that might not be present in a specified number previously, overgrowth of certain organisms due to the changes in what is normally there, and that can be due to antibiotic use. It can be due to dietary changes, actually eating more processed foods. So there's a variety of factors that can change the bacteria that live in the gut and the toxins that can be produced therein.
Is there anything you can do to get rid of the toxins, or maybe after you've taken an antibiotic or maybe eaten something not so healthy, you can clean out your system, or is that not really how it works?
That's not how it works. It's really a lifestyle of prevention. It's decreasing the need at the societal level for a high antibacterial load. Taking antibiotics when they're not needed, for example, is always a speculative factor. Eating foods that are not particularly pro-inflammatory, so limiting heavy fats in your diet, limiting red meats, maintaining a healthy weight, and being very active certainly are contributing factors. So while this research may be groundbreaking, as it is a critical piece of the puzzle, I think it may be a critical piece of the puzzle. I think that a lifestyle and prevention, understanding that the research is ongoing to elucidate all the components, is key.
Dr. Peterson, the study found the toxins caused DNA mutations that are more than 3 times more likely among the patients under the age of 40 compared to those who are over the age of 70. Why do you think that is?
I think there's a different etiology to patients under age 40 for colorectal cancers. I think the preponderance of the literature states there's a different natural history of the disease, that even though there's a paucity of research on how to manage the young with colorectal cancers under age 40 and even under age 50. I think as the evidence grows, we will understand these diseases as being biologically different than those that occur in older individuals.
Got it. All right, doctor, great to have you. Thank you so much for your time.
Thank you.